I've always wanted to be a physician, always knew I wanted to be a cardiologist. Got to observe my father as a family practice physician in North Georgia and East Ridge practicing, and just loved what he did. I'm very similar to him, and so it was just very natural and kind of resonated with my wavelength in my DNA, so to speak. So I always knew I wanted to be a physician, and I always knew I wanted to be a cardiologist. Joy at work and the impact it had on the patients, the way that they spoke about his care and his character and the impact he had on them. So getting to witness not only the fulfillment it gave my dad having that opportunity and as his career, but also the impact it had on the people, the way that they spoke about the experience with him, and also they spoke about his personality and character. Seeing a good outcome it's awesome. The field is advancing and it makes your doctors look really good, whereas a lot of times just the therapies are really good and you've got a good physician as well. But the field's advancing, there's a lot of research that goes into it, there's exciting time to be a cardiologist just because of the advancing therapies that are available to help people feel better and live longer. Cardiology is fascinating, the way the cardiovascular system works, all its complexity, and then also the seriousness of when it goes wrong. So it's both fun and serious at the same time. I'm into cars and engines, and there's a lot of kind of white lie or simple analogies to be made between a car engine and a human heart. But I think the way my mind works, I love the electrical and the fluid dynamics and the mechanics of the heart. It was fascinating. What excites me the most about joining the team at Bradley Medical Center is the patients, specifically the personality and character of the area that defines the culture, the value set that is the values held in this community, the geography, the economic opportunities, all of that. But mainly the people that I will be serving in this area is what excites me about this. Additionally, joining a group of physicians here that many of which I already know and value their skill set. They're excellent physicians and they are just excellent people. So I'm excited about both aspects of that. A great job and great patients. Seeing the rapid upward trajectory of patient care in the area based on the investments that Vitruvian is doing to the hospital, not only hiring talented, good people, but investing in the technologies that are necessary for improving patient care. I think that's what sets me apart, is the ability to rapidly acquire information through those resources and implement that into my practice. Prevent disease and help people feel better and live longer. I'm a broken record, very simple. So that's the way I have been practicing and will continue to practice, and pray to God every day that I do right by my patients. Yeah, just easygoing. Spend a great deal of time raising my 4 kids, lots of time with my wife, my friends, family, have some hobbies here and there, do some home projects, work on cars, exercise quite a bit, and just really trying to enjoy life at the stage that I'm at with 4 young kids, and that's kind of who I am outside of work. But yeah, I would say that my family life positively impacts my work life and vice versa. And just the values that I get out of being a family guy and the transformative nature of having children and a marriage makes me better at work, not only from a prioritization standpoint, but also from just like a value standpoint.